If you're currently suffering from pudendal neuralgia or have a history of pudendal neuralgia and are currently pregnant or wanting to get pregnant, stick around for the next few minutes as we debunk some of the myths surrounding pudendal neuralgia and pregnancy and give you tips and tricks on the best way to get through your pregnancy and delivery. First and foremost, pudendal neuralgia does not affect your fertility. Because you've had pudendal neuralgia or maybe still suffering with pudendal neuralgia, it does not affect your ability to get pregnant. There are many things that can affect fertility, but having pudendal neuralgia is not one of them. So if you're still currently suffering from the symptoms of pudendal neuralgia, it's best to work with your physical therapist and the rest of your treatment team to try to resolve as many of those symptoms as you can before getting pregnant. However, if you can't resolve all the symptoms and you would like to get pregnant, it's not the end of the world. You can continue to work with your trusted physical therapist throughout your pregnancy so they can best support your pregnancy and get you ready for delivery. So it's always a good idea to try to resolve your symptoms of pudendal neuralgia as much as possible with your physical therapist and the rest of your treatment team before trying to get pregnant. However, if you got pregnant and you have some symptoms of pudendal neuralgia, it's not the end of the world. Just keep working with your trusted physical therapist and treatment team throughout your pregnancy and into delivery. So let's talk about a few things that you should be aware of if you have a history of pudendal neuralgia or are currently suffering from symptoms of pudendal neuralgia and are currently pregnant. So if you have any history of sacroiliac joint dysfunction, you want to make sure that you support those joints throughout your pregnancy. So a supportive belt for your belly or a supportive belt for your sacroiliac joints may be helpful. Another thing to keep in mind is to make sure that you maintain good bowel health. It's very important for the pudendal nerve and the health of the pudendal nerve that you don't strain during a bowel movement. When we strain during a bowel movement, it puts tension on the pudendal nerve, which can irritate it further. So keep in mind all of those things that you have likely learned from your physical therapist to maintain good bowel habits. Another thing you want to keep in mind is if you currently have symptoms of pudendal neuralgia and are pregnant, you may want to use a pressure relieving cushion. There are a variety of cushions available, many of which have a cutout in the middle to help relieve pressure on that pudendal nerve and the surrounding pelvic floor muscles when you sit. Another thing you want to keep in mind during pregnancy is that you stay active. When you stay active, you get good blood flow throughout your body, which your muscles and nerves need to stay healthy and happy. It also will help to manage your weight gain during pregnancy. It helps with good bowel health, and it's good for the baby. The question always comes up for my patients that have had pudendal neuralgia or are currently suffering from pudendal neuralgia and are pregnant is what to do at delivery. Is it safe to have a vaginal delivery? Should they opt to have a cesarean section? And it's important to note that during a normal vaginal delivery, there is significant tension put on the pudendal nerve. So if you're currently suffering from symptoms of pudendal neuralgia or have had a history of significant pudendal neuralgia, it may make sense to consider having a cesarean section or at least talking to your obstetrician about that option. If you're not currently having symptoms of pudendal neuralgia, it's perfectly safe to have a vaginal delivery. At the end of the day, the point is to have a healthy baby and a healthy mom. So consider these options, talk to your treatment team about the best approach for you and the best way to have this baby. If you found that helpful and want to learn more, just click on one of the resources listed below.